You've been referred to our Bryan Heart Structural Heart Program to begin an evaluation of your heart valve disease and to determine if a transcatheter aortic valve replacement, or TAVR, is right for you. TAVR is a new way of replacing the aortic valve in your heart. In the past, the only way we had to replace this valve was through an open heart surgery. Today, we can often use a long, thin tube called a catheter to replace the valve. First, we make a small opening in a blood vessel in your leg. We then insert a catheter, threading it up through the blood vessel and into the heart. This catheter carries the new valve into the right position and is placed on top of your old valve. You will be under monitored anesthesia care during the surgery and then spend approximately 1 to 3 hours in recovery before going up to the progressive care area. Most patients spend a total of 2 days in the hospital, or 1 overnight. You have a disease called aortic stenosis. Aortic refers to one of the 4 valves in your heart. Blood passes through the aortic valve as it is pumped from the left ventricle to the rest of your body. Stenosis means narrowing. Therefore, aortic stenosis is the narrowing of your aortic valve. This most commonly happens as people age. Over time, the valve stiffens and does not open or close properly. Less blood flows through the heart valve, and your heart has to work harder. This may make you feel short of breath, have chest pain, or feel faint or very tired. To decide if this surgery is right for you, we need a lot of information about you, your heart, and your general health. Once we have gathered all the needed information, we will discuss all your treatment options. The final choice will be yours. To give us a complete picture of you and your health, you will need the following tests. Transesophageal echocardiogram, or TEE, is an echocardiogram or echo test where an ultrasound or sound waves are used to make an image of your heart. During a TEE, a physician inserts a narrow tube with a small probe into your mouth and down your esophagus. This allows the doctor to record images of your heart from the inside, providing images closer to your heart. Coronary angiogram or heart catheterization checks your heart and blood vessels. A catheter is inserted into a blood vessel in your leg or arm, then guided into your heart. Once in place, X-ray dye is then injected through the catheter. This dye helps the heart and blood vessels show up more clearly on X-rays taken throughout the exam. During this test, your doctor may place additional catheters in your heart to measure the pressures in different areas of your heart. Arterial studies are Dopplers or ultrasounds of the arteries in your legs. The physician is using this information to look for any blockages or narrowed arteries in this area. Carotid Doppler is an ultrasound of the arteries in your neck. The ultrasound is used to look for any blockages or narrowed arteries due to plaque buildup. Pulmonary lung function testing, or PFT, is a breathing test that measures how well your lungs are working and how effectively they are transferring oxygen to the rest of your body. CT angiogram is a scan that takes very detailed pictures of your blood vessels to tell the doctor the blood vessels in your legs are big enough to carry the new valve to your heart. Testing required for TAVR assessment is typically split up over a 2-day period. Once you have completed all the workup, your individual case and testing results will be reviewed by the Bryan Heart Structural Heart Team, a multidisciplinary team of experts including Cardiothoracic Surgeons, Interventional Cardiologists, Invasive Cardiologists, and advanced practice providers and nurses. As with any procedure, there are risks and benefits that each individual needs to evaluate personally. The risks of TAVR procedure are vascular complications, bleeding, need of a permanent pacemaker, stroke, death, but benefits to undergo the TAVR procedure include improved quality of life, relief of symptoms, less invasive than traditional open heart surgery, shorter hospital stays, and shorter recovery time. If you decide that the TAVR procedure is right for you, you can expect the following as part of a recovery process: a 24 to 48 hour stay in the hospital following the procedure. The dressing on the incision site will be removed within 24 hours. Showering will be allowed 24 hours after the procedure, but no tub bathing or submerging of the incision site for at least 2 weeks. No lifting more than 10 pounds for the next 5 days, and then no lifting more than 20 to 25 pounds for the next 2 days. At Bryan Heart, we put the patient first by involving you in your care. Our structural heart team is here to support you with any questions or concerns you may have during this time.